Marshall University Minority Health Institute celebrated the $1 million donation from Unicare Health Plan of West Virginia as a community investment grant. Unicare and Minority Health Institute have been working as partners to bridge the gap between health disparity among minority communities who are medically underserved. Mrs. Walker Dean, who is the coordinator for West Virginia Minority Health Initiative and Marshall University Minority Health Institute, took the center stage and gave some remarks.
I am the Marshall University Minority Health Program Coordinator as well as the West Virginia Office of Minority Health Program Coordinator. We do the roles and responsibilities of the West Virginia Office of Minority Health. So I want to thank everyone that has come out to support this magnificent milestone within the Minority Health Institute, community, and state of West Virginia. I want to thank Unicare, Health Plan of West Virginia, for this amazing opportunity to continue to do the vision and mission of the Minority Health Institute with this $1 million community investment grant.
The Unicare Health Plan of West Virginia President, Tal Hayes, said they are committed to provide everyone with access to health care.
Unicare is committed to improving the health of our communities. We are addressing the complex and interconnected factors that impact health. Things like food, housing, social, and financial services. We know that communities here in West Virginia face a wide range of challenges that impact quality of life. These factors are known as social drivers of health, and according to the CDC, these are conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life risk outcomes. As much as 80% of a person's health is influenced by drivers of health. I am proud to present $1 million investment to address health equity and disparities to the Marshall University Minority Health Institute. We're going to work.
Then came the president of Marshall University, Dr. Gilbert Jerome, remind everyone that minority, especially black folks, are always on the disadvantage when it comes to health care.
We know that. According to the latest Minority Health Report in West Virginia, black West Virginians die of cancer, diabetes, heart disease, and stroke at higher rates than white residents.
The Dean of College of Health Professionals, Michael Priwe, also gave some remarks.
I'd like to also thank Dr. Ward and his team at the Minority Health Institute. Does a lot for this program as well, and we appreciate your activities. As some people have said, this funding is going to be used to improve health equity and address social determinants across the spectrum, targeting those underserved communities in the state. Implementation of this program is kind of divided into two areas. There's an outreach, continuing education, prevention, health promotion piece, and then there's a research core piece as well, which is extremely important. We keep our head again in front of the game in terms of doing research in this area. Studies have shown that quality of care and indeed life expectancy disproportionately depends on the zip code you live in and the color of your skin. And I think finding solutions and doing this outreach and prevention and continuing education is extremely important.
Then the mayor of the city of Huntington, Steve Willem, emphasized on the importance of good health for everyone.
If anything that we have in our communities is that we have to be intentional in our action. Much of it we are experiencing here in Huntington is that there are those who are underserved, those who are poor. Minorities in particular find that the healthcare system is not available to them as is available to larger populations. And this is something that what we have to endeavor and be intentional upon doing is assuring that every individual has the opportunity, being intentional in
Dr. Anthony, who is the founder and director of Marshall University Health Initiative, chair and professor at the Department of Public Health, who is the brain behind this research leading to this wonderful award, took the podium and gave a brief biography of himself and how he came to West Virginia.
I had to find a reason to leave Boston to come to West Virginia, and I found that reason. My first research showed that health disparities that we talked about in our classes, this was the place it was.
Saying he began his research focusing on health disparity among African Americans.
And I took the last 2 decades in West Virginia to address health disparities. This work and this grant is a culmination of those years of going to McDowell County, going to Bluefield, going to Princeton to understand health disparities. One area of health disparities that stuck to my mind today, and when I met with the leadership of Unicare, I told this story.
He walked led him to the discovery of the untold story, which opened doors to Minority Health Initiative.
That I wanted to understand where our students were coming from. And what I found, that breast cancer was real in West Virginia. But what really touched my heart, that even though African Americans, small population, some population of West Virginia, they disproportionately bear the burden of health disparity. That African American women disproportionately have the disease and die of the disease compared to their white counterparts. I have to do something about it. I approached the Office of Minority Health in Washington, D.C. and said, this is what I found. Fortunately for me, I was the only researcher that approached them, and it funded me $100,000. I took all of the data and approached the National Institutes of Health and said, look, this is the situation in West Virginia, we have to do something about it. I said, you understand what you're saying, Dr. Ward, because I presented with data that they could understand. And this was the beginning of Minority Health Institute.
Dr. Anthony went further to acknowledge the Dean of College of Health Profession with a wonderful testimony.
That the Fred took money out of his own budget to pay for that. He bought equipment for us. And he supported us. He lent his prestige to the work that we do. And I cannot thank him more. But you will be remembered for this day. Thank you very much.
Giving emphasis on the mission of Minority Health Institute, while assuring Unicare, the donor of the fund, that it will be used for the purpose intended.
Will help us to follow the mission and goal of Minority Health Institute, which incidentally is consistent with the goal of Marshall University and the mission of the College of Health Profession. We can assure you that this fund will be spent for the purposes for which it was given.
He then outlined how the fund would actually be used, including 3 scholarships for minority students to pursue a master's degree in public health.
Priority number 1, and recruit at least 3 minority students, African American students and rural population students, Medicaid students, motivate them, sponsor them to earn Masters of Public Health at Marshall University free of charge because of this.
Attendant, some of the minority community that were present were very excited for the wonderful achievement and the award.
Minorities and lower-income individuals here in the community. It's very exciting. Public to provide lots of opportunities for the youth and other individuals that may need it in the future. It's a very exciting time for our city, for the Fairfield community.
That finally someone has noticed that there are needs in this community that need to be met. Certainly health is always an issue